I'm very pleased to introduce Senator John Barrasso of Wyoming. He's a Republican. He's a medical doctor, an orthopedic surgeon of 20 years standing, past president of the Wyoming Medical Society. And in Wyoming, in his home state, they call him Wyoming's doctor. Senator, thanks for joining us.
Hey, great to be with you this morning. Thanks so much for having me, Jed.
Well, it's my pleasure altogether. This is the first time we've talked, and I've really been looking forward to this. First off, you're a long-standing practicing doctor. Now, you've been down this road with Medicare and some of the other government programs, and let's just talk a minute about how this is going to affect the availability of care. We're talking about Obamacare versus the elderly, the people who are senior citizens, the people who are most dependent on Medicare services. With the cutbacks, well, first, if you can just help us explain a little bit about what you see the cutbacks in the costs and payments and services available that Obamacare is going to cause our senior citizens.
Well, I have great concerns about the cost to our seniors, Jed. My mother's on Medicare. My wife Bobby's mom and dad are on Medicare here in Wyoming. And the real concerns are they're talking about starting this whole new government takeover of medicine under the president by what he calls savings, what I call cuts of $500 billion in Medicare. And part of it is he wants to eliminate a program that a lot of people in Wyoming and around the country feel benefits in. It's called Medicare Advantage. About 1 out of every 5 people on Medicare are under this program, which does a much better job than regular Medicare at prevention, at managing long-term illnesses, helping diabetics, helping people stay healthy longer. And the president wants to eliminate that program completely and then force these 10 million Americans who are seniors who have made their contributions over the years and are on Medicare Advantage, and they're going to get wiped out of that, forced onto regular Medicare, and for many of them, they're going to end up paying more out of their own pocket. Plus, we also know, Jed, that across the country, people on Medicare often have a hard time finding a physician because Medicare, and government in particular, is the biggest deadbeat when it comes to paying the fair cost of the care. And so doctors prefer, who have obviously an obligation to take care of all patients, but sometimes a challenge for patients on Medicare to find a physician, especially as many doctors are overworked and working extended hours. So I think that what the president is proposing is going to be worse for our seniors.
Well, now, I keep hearing, Senator, and I really enjoy talking to you on this particular issue because you have an experience that I think most of the other people we've talked to have not had. Now, we're always told that, well, all right, Michael Moore thinks that Cuba is medical nirvana, but so many people, and unfortunately a lot of your Democratic colleagues and people in the House, seem to think that Canada has the best sort of system. There's no option. You're going on the government plan or nothing else. You have treated Canadian patients coming down here, right? Why do they come here?
Well, and in all across the United States, people from Canada who have means come to the United States for care because they don't want to wait in the long lines. They don't want to be put to the back of a line just to get in the first place, whether it's for an MRI or a CAT scan, if they're worried they have a tumor. It's at least 3 months wait to get the study, and then if they find out that person does have cancer, then it's to get at the end of another line to get care. So people in Canada who have emergent needs come to the United States for their care if they're able to pay for it.
That's amazing.
If something like the Canadian system comes here to America, where will Americans end up going for the care that they need? Because there won't be another place to go. And when Calgary all of a sudden, in Canada decides they want to cut the number of cataract operations they do solely for financial reasons, they say, well, we're going to do 2,000 operations less this year than last year. It's not because the need is going down. They say, hey, well, forget about it. We're not going to pay. And, if you want it done and you have the money, go to the United States to have it done.
Senator, this is really important information for our senior citizens, for Americans of all ages. Let me play something for you. I won't play his answer, but this is a questioner in a town hall hosted by Senator Ben Cardin of Maryland just yesterday. An 11-year-old boy asks Cardin a question, and I'd like you to answer it. We won't play Cardin's answer, but here's the question.
I'm an 11-year-old from Hagerstown, Maryland. I have 5 grandparents, so this issue applies a lot to me. Say my dad and my grandfather both came down with cancer. Would my dad get priority care because he's younger and can contribute longer to society?
What do you think, Senator?
Well, in England, the boy is absolutely right. That's what would happen. And That's the concern that none of us want in the United States. We don't want to have those lists like that and decisions being made on purely financial reasons. We want to say we want to help people. We want to detect problems early treatment, early detection. But Medicare, that people hold out as the best program of all time, as many Democrats do, that has never coordinated care. I practiced orthopedic surgery for 25 years in Wyoming, and my wife is a breast cancer survivor. So when you raise a question of cancer, I look at it from a doctor, but also as a husband. And my wife's had 3 operations, been through 2 bouts of full chemotherapy, been through radiation, the whole deal. So we know what's involved when cancer involves your family. And we want the American system, not what we're seeing in other countries. That's what I want from my wife, my family, my kids, my parents.
Well, God bless. I really, I'm sorry for the interruption, but, this strikes home with me very, very close. I mean, my mother died of breast cancer. I'm a 17-year cancer survivor myself, and I have a really hard time believing that I would be here today if I had to wait the weeks and months. I mean, I went from diagnosis to surgery, I think, in 3 days.
Yeah, and in Canada, it would have been 3 months delay before the diagnosis was made. And then you say, how far would the cancer have progressed in that time?
Yeah, I don't think I'd be here talking to you.
That's why we don't want that for America. And I'm glad people are listening to you right now in Riverton, Wyoming, on KVOW 1450. Where,
hey, there you go.
Where where the Fred Thompson Show is heard every day at 10 a.m. Mountain Time.
Well, that's wonderful.
People of Wyoming get it. And I'm having a town meeting tomorrow in Worland, and looking forward to visiting with people from Washakie County in Wyoming. And I expect that we're going to talk about health care. We're talking about a lot of other things that affect us, our Second Amendment rights, cap and tax. I mean, there's just a lot of things on the minds of people in Wyoming these days.
Well, Senator, it seems to me that they've got pretty doggone good representation back here right now, and you're one of it. You're a major part of it. I really am very glad to have talked to you, and I hope to talk to you again soon. We at Human Events are going to be all over this issue all the time. So, Senator John Barrasso, very good luck in your town hall meetings. Not that you're going to need it. Jed Babin for Fred Thompson.